Good afternoon, everyone. Welcome. My name is Shawn Cotton. I'm director of the Osher Center for Integrative Health at the University of Cincinnati. We're delighted to have you with us today. The Osher Center's primary mission is to help transform a system of primarily sick and disease care to one that also incorporates and prioritizes well care, self-care, and prevention. And we do that through research, education, clinical service, and community engagement. This is a virtual series, a lifestyle medicine wellness series. Oftentimes we do in the evening. We're trialing it during the day today. It happens several times a year, and it's an opportunity for us to bring some of our esteemed faculty from the Osher Center and from the university to the community to share their messages and their thoughts and their expertise with you. Jalicia is with us, our wellness program manager. She's going to be monitoring the chat for any questions that will come up during the presentation. So please feel free to put a question into the chat and Jalicia will address the presenter as able. So we're excited today. We've got two speakers with us. I'm excited to introduce our partner from the American Heart Association, Amy Kleeman. She's our development director. Amy has almost 20 years of nonprofit experience working directly with large national nonprofits as well as small grassroots like the Alzheimer's Association, the Archdiocese of Cincinnati, Cystic Fibrosis, the American Cancer Society. With the American Heart Association, Amy helps oversee the Heart Mini and Cycle Nation, two major fundraising events that many of us know about that make a huge impact to the tri-state and beyond. So I'm hoping Amy is with us. I don't see her on video here, but I'd like to introduce you to Amy. And I'm wondering if Amy, I see her name, but I don't see her video yet. So I may have jumped the gun a little bit, my friends. Amy, are you with us yet?
I am. My video is not working for some reason, so I am here though.
No worries. Welcome. I think is Jalicia going to run the slides. Welcome, Amy. We're thrilled to have you here today.
Yeah, thanks so much for having me. Good afternoon, everyone. Like she said, I am Amy Kleeman. I am here with the American Heart Association. I am going to go over some things that we're working on, as well as talking a lot about our upcoming Heart Mini Marathon and Walk event. UC Health is a sponsor and a partner with us, and they have right now over 700 participants already signed up, and they are well on their way. So I will be focusing a lot on that towards the later part of this. But first of all, I just want to say thank you so much for being here this afternoon, for saying yes to your health, to saying yes to help saving lives, and saying yes to hopefully the Heart Mini when we are all said and done. You can go to the next slide. So our big mission this year and what we're really focusing on is at the American Heart Association, we want to be a nation of lifesavers. We do not want to be a nation of bystanders. And this goes off the statistic that 9 out of 10 people who suffer sudden cardiac arrest actually die outside of the hospital. And so we want people to be confident in taking action if they're put into this scenario to start the hands-only CPR and to really take action with the first step being call 911 and then take the action of the hands-only CPR. And how we're doing that is we're going into local companies, manufacturers, schools, churches, you name it. We are going in and doing demonstrations, sharing some videos, some scenarios, and then actually letting people practice on our mannequins of doing the hands-only CPR. Again, just to make more people confident and educated in case you're ever put into this situation. Next, please. So our big goal in the next 5 years is to double that survivor rate. So hopefully it will, we'll see a better increase in numbers. And again, how we're doing that is we are going into communities and we're coming up with these cardiac emergency response plans. So if you're at your work or your place of employment and somebody goes into sudden cardiac arrest, kind of bringing the attention of starting the hands-only CPR, calling the 911, and then also focusing on where the AEDs are located within your building. A lot of people don't know that AEDs are either there or not there. And if they're not there, kind of giving you the education of where you can get an AED and really putting that emergency response plan in action. Just because we never know when somebody's going to go into cardiac arrest, who it's going to be, or where you could be. And so we really want people to take action and really start to save lives. Again, we're doing that with the AED training and the CPR, and so we really want to be the nation of lifesavers and not a nation of bystanders. Can go to the next slide, please. So this is all the events that we have coming up and that we really focus on here in the greater Cincinnati area. So upcoming, we have the Heart Mini Marathon, which will take place on March 16th. So we have various events that you can do. You can do the half marathon, you can do the 5K race, you can just do the walk. We also have UC Health is the presenting sponsor for our Steps for Stroke. So that's any stroke survivor, whether it was yesterday, 3 years ago, 10 years ago. We invite all of our stroke survivors to come out and take that 1,000 steps with us. And it's really a celebratory event that we have going on. We have a kids race, and then we just have our 5K walk. That's a very family-friendly oriented. It's right there in downtown, so it's right in front of the P&G Gardens. So that's where everything takes place. And there are different variations of registration fees. And you'll see that once we get to the website and to the end of this presentation, there's a QR code that you can scan. It would bring you right to the UC Health page. Also coming up this spring, we have our Go Red for Women experience. That's May 1st at Great American Ballpark. And that's really where we come together as women, because this is the #1 killer in women is heart disease. And so we come together at Great American Ballpark, and you just have a fun day of interacting on the Reds field, Yeah, that's right, Reds turf field, and taking some batting practice, pitching practice, throwing, and just being on the field and being active and really having fun with a bunch of women for a good cause. And then this fall, we have our Cycle Nation, which is a stationary bike event. It's where you will be cycling for 2 hours, but you are with a team of 8. So usually each person takes about 15 minutes. You can rotate on and off. And it's really fun. Some people take it really competitive, and then some people just do it for leisure and just to have a good time. It's usually it's a Thursday night down at Fountain Square. So it's right in the midst of people are getting out of work too. So it's really fun to see like people coming up and just asking a lot of questions like, what's going on here? But the bikes are, it's pay to play. So you do have to purchase a bike. It's $2,500 or $2,500 or $5,000 for the VIP bike. And the VIP bikes, you get like a goodie bag. You get drink tickets because there's a bar on site. So it's just a bunch of fun that we do down on Fountain Square. And then if it's bad weather, we do have a backup plan just in case. But last year we had beautiful weather. It was so much fun, and we sold out of our bikes. We have to cap it off at 75 bikes because that's all that fits at Fountain Square. So these are our 3 main events that are coming up here soon. Just wanted to kind of show you that we have a variation. If the Heart Mini doesn't fit for you, there are other opportunities that you can participate. If you want to go to the next slide, please. So a lot of people always ask, working for nonprofits and fundraising for nonprofits, where does our money go? Does it stay in a community? And Cincinnati is very proud to say that the money that we fundraise actually does come back to the community from the American Heart Association. So our Greater Cincinnati chapter every year usually fundraises between $6 million and $6.5 million. And in 2023, the American Heart Association granted out 3 research projects for the 2024 season, and it was over $8.5 million. So Cincinnati is actually receiving more money back than we are fundraising. So this is something that we take a lot of pride into, and we like to share it out with everybody because that is the #1 question that we get is exactly where the money is going. And so this is something to prove that Cincinnati has a great research and medical and is really helping drive the mission of the American Heart Association. You can go to the next slide, please. So some of the research funding that we do and some of the programs that we host, we are really big on nutrition and security, sorry about that. And then we really focus on maternal infant health outcomes. And we really focus right now on heart disease and blood pressure. So for anybody who is looking for more information for that, you can go to our website. But I just wanted to touch base that the American Heart Association is currently funding $12.5 million in the Greater Cincinnati chapter. So we still do have some that are ongoing that are multi-year research projects. And unfortunately, you can see we have another 1,500 applications. So we are still looking for that more funding. So that's why we're driving people to our events to help with the fundraising. Also, like I said before, a big thing of our mission this year is the Nation of Lifesavers with learning the hands-only CPR. And it's kind of the play off of the Damar Hamlin case that happened here in Cincinnati, how he went into cardiac arrest down at Paycor Stadium. And he's a big advocate for the American Heart Association now. So these are just some of the things that we're really focusing on. And again, if you need information, my email will be at the end of this presentation, or you can go to our website to find out the exact funding of these research projects and where they stand. Next one, please. Next slide. Okay, so a little bit about the Heart Mini that's coming up here in a few weeks. Again, UC Health is one of our sponsors. If you want to go into the next slide, I'll tell you a little bit more. So some of the dates that we have coming up is in February right now. We're really looking at team and coach participant recruitment. And then we do a lot of the fun, F-U-N with a capital fun, raising here in the month of February. And we are going into companies and places like schools and churches and doing some internal kickoffs where we do a whole presentation on everything that the Heart Mini is. It's a longer version of this. And then we do go into the CPR hands-only demonstration and the AED training if applicable. So if that's something that you want to get interested in or you want to become more involved with, again, my information will be at the end. And then March 16th is our date. So again, there is a list of the different events that we have. It's a rolling start. So if you do participate in the half marathon or the 15K race, it's a very early morning for you. And then it goes from there with the 5K race, the Steps for Stroke, which is the stroke survivor. And then we have the kids race, which is a 1.5K. And then we have the family-friendly 5K walk that starts at 11. All these events together usually bring in about 20,000 people. So it's really cool to come down in downtown Cincinnati and see everyone in usually red. And it's just a sea of red that takes place going down the main Fish Street of downtown Cincinnati. So it's a really cool experience if you've never been to come check it out this year. If you want to go to the next slide. So ways that you can get involved and register is you can download our app if you want. So it's a new mobile app, and you can just download that. You can do the same thing that you can on a desktop or a laptop. You can recruit, you can do schedule messaging as far as text, social media posts. You can deposit checks from there. And then you can also do a physical activity trackers on there too, and it will sync to any other app that you have on your phone or your Apple Watch. Next slide. So some special recognition that we do at the event is, again, any heart or stroke survivor will get a red bib. They'll get a special red carpet at the finish line. They'll get a medal and they'll get a VIP breakfast. This takes place in an inside area, so it's a warm, hot breakfast. And then also our heartthrobs, anybody who raises $1,000 or more gets a personalized course on the sign. They get their name on a huge banner that's listed on, or that's hung up downtown. And then they get a discount code to purchase some swag items. And then they're also invited to the VIP breakfast. You want to go to the next slide? So if anybody has any questions or you need help, there is my information. I'm happy to answer any questions that you have offline. And then there's the QR code. If you want to scan that on your phone right now, you can, and that will take you straight to the UC Health page on the Heart Mini page. And you'll see there's various teams. I think they're close to almost 80 teams and over 700 participants already. So you can either pick a team that you want to join if you're with a department or if there's somebody that you know, or you can start your own team under UC Health as well. But thank you very much for your attention. And again, if you have any questions, just feel free to reach out to me.
Thank you so much, Amy. I know you're going to stick around for questions, but before I introduce our fantastic speaker, there's a quick question in the chat about where can I go for CPR training? Would Sandy email you directly, or do you have a short answer for that?
Yeah, Sandy, you can email me directly. We have a link if you want to get certified and trained that you can find a trainer here in the Cincinnati area. If you just want a demonstration, I can always come out and do that too. So there's a two-part answer to that. So I would just email me and we can talk about more what you're looking for.
Thank you. Thanks, Amy. And I'm going to ask that Jalecia put that last slide into the chat. Someone's asking for the QR code. Okay, so thank you, Amy. It is now my distinct pleasure. Dr. Florence Rothenberg is one of my favorite people who totally inspires me, who I don't get to see very often. And so I'm so happy she's with us today. Dr. Rothenberg is a professor of cardiovascular medicine at the University of Cincinnati and the VA Medical Center, director of cardiovascular rehab at the VA Medical Center, owner of Heart of Northside, Heart and Balance LLC, and executive director of Food for Thought Cincinnati. Her current mission is to promote cardiovascular health through community. She's working to understand obstacles that her neighbors experience to cardiovascular health and develop ways to overcome these obstacles. It is my distinct pleasure to introduce to you all today, Dr. Rothenberg.
Thank you so much, Dr. Cotton. I'm really grateful for that wonderful introduction and your kind words. You mean a lot to me as well. And I am going to share my slides. You should all see that. So as you heard, I'm a cardiologist, and what led me to do this community work? I have been working at the VA since 2008, and many of the young men in particular, and women as well, but men in particular that I see coming in with heart attacks, strokes, kidney disease, heart failure, all of this could have been prevented through lifestyle, through healthy eating. And I was very frustrated by this. Dr. Cotton will attest to that. That led to many conversations between the two of us as to how I could make a change, a real change in this problem. And so that led me to the work that I'm doing in Northside. And I will tell you about my insights from the Heart of Northside. As you have heard, heart disease is the #1 killer of men and women in the United States. This is the most recent statistics that we have. And you can see that heart disease remains the #1 killer of men and women for many years, for at least 100 years, as long as we've been keeping records. We know that diet plays an important role in the development of heart disease and then the treatment of heart disease. This study done in Mass General shows that it was a computer modeling study, and they showed that the increased eating or the decreased eating of these 10 foods listed on this slide resulted in, if you ate more or less of these foods, that accounted for 18% of all ischemic heart disease, stroke, and type 2 diabetes costs in the United States. Just underscoring and highlighting the role that food plays in the development of all kinds of disease. This study shows a direct effect on cardiovascular mortality because of food. This study was published in JAMA in 2023, and this is over 100,000 men and women in the health field. It's a prospective cohort study looking at 36 years of follow-up. And they found when they looked at diet diaries and they compared mortality among the highest eating fruits and vegetable group and then the lowest eating fruits and vegetable group, they found a difference, a reduction in mortality of over 19% in the group that ate the most fruits and vegetables. And that's pretty profound. In addition, all of these scores were significantly inversely associated with death from cardiovascular disease, cancer, and respiratory disease. So this is across the board and affects many disease categories. Very importantly, and this is crucial to what I'm going to talk about later, inverse association, so improvements in mortality, were also consistent across different racial and ethnic groups. So we saw this in Hispanic groups, Black groups, and white groups. How do we do this? So let's look at the cost of food in our country now. Let's get a sense of what we're spending our money on. This study was published in 2021 through the Rockefeller Foundation. And they found that when you look at the overall production of food, packaging, shipping, selling, all of those kinds of things, it costs about $1 trillion to grow and sell our food in this country. And this is from 2021. But they did a very unique thing. They also looked at the negative impact of our food systems on health and the environment. And when they add those features in, they see that that adds an additional $2 trillion. And this slide spreads that out a little bit. And you can see that the human health in itself, the negative impact on cost of obesity and overweight, and other problems, treating hypertension as that results from our food system, treating cancer and diabetes that results from our food system, the impacts of food insecurity, and the impact on pollution from the shipping of the food. All of these things add $1 trillion of cost to our health system. So what is the most, I would say, the most nimble, the most easily impacted risk factor that's impacted by diet? And a lot of people think cholesterol, and that is true. Cholesterol is impacted by diet, but that can take months to see an effect. It's really hypertension. And I'll show you some data about that. About half of all adults in the United States have been diagnosed with hypertension, and that's the known diagnosis of hypertension. So that's half of all adults, 48 million, over 120 million Americans. And when you look at the yellow bar at the bottom, you see that we're only getting about 23% of these patients, these adults, under control. So that's leaving about 3/4 of all adults either poorly controlled or completely uncontrolled with hypertension. We know that diet has a very profound impact on treating and addressing hypertension. This slide comes from the recent 2024 American College of Cardiology self-assessment program. We're required to keep up on our training, and this is one of the modules on hypertension. And so very up-to-date data showing that adopting the DASH eating plan, which the DASH diet is essentially increased fruits and vegetables and low-fat dairy. And when you adopt the DASH eating plan, you can see an 8 to 14 millimeter improvement in blood pressure. The panel on the right shows that this effect may be even more potent for our Black neighbors than for our white neighbors. And that's a very interesting point that will come up later. So not to be so doom and gloom, we are making some impact on mortality from heart disease. And this chart summarizes the most complete summary I've seen of our impact that we've had on heart disease death rates in the United States for 2009 to 2019. And the black bar in the middle shows the total reduction in mortality in heart disease that we've seen over that decade. And this is largely through medical and interventional accomplishments. And you can see that we've made about a 3% reduction in mortality over this time period. That's pretty good. We can pat ourselves on the back. At least we're not going up, but it's still not that great. When you pull out the impact on different ethnic groups in our country, you see that there is little to no improvement in mortality for Black, Hispanic, and Pacific Islander subgroups. So we're making some progress, but we're really not hitting all of Americans, and certainly not those who are at high risk. So we must do better, but how? And we should focus, and I tell this to all my students, we should always focus on people who are at the highest risk, because we'll see the greatest impact right away, and we'll be able to determine what the obstacles are that we can have great impact on. And that actually turns out to be our Black men in our country. And so this data comes from the Journal of Hypertension. It was published in 2020, and they showed that there is higher mortality for Black men across all categories of hypertension and related cardiovascular disease. And panel A shows the overall negative impact on Black men. And you can see the top bar is mortality in Black men over since 2000, the year 2000. And you can see that that is much higher than mortality for Black women, for white women, and white men. This is true for hypertension mortality related to ischemic heart disease caused by hypertension. That's panel B. Panel C, which is mortality from hypertension-related heart failure and hypertension-related cerebrovascular disease or strokes, and that's panel D. So Black men suffer the most. Why is that? This slide gives you some clue as to why hypertension is causing mortality the highest in Black men. And that is likely due to inadequate recognition and treatment of hypertension. And this chart comes from a paper published in Hypertension as well in 2021. And they show in panel A that the prevalence of hypertension is greatest among Black men and women, but the awareness lags behind in Black men. So Black men are less aware that they have hypertension. The treatment lags behind again for Black men, and the control achieved again lags behind for Black men. So this points to some clues as to why Black men suffer the most. So to summarize that portion, cardiovascular disease remains the #1 cause of death for over 100 years in this country. Inadequate healthy food access contributes to about 20% of this mortality. The current food supply contribution to medical costs is over $1 trillion, which we can address through addressing the food supply. And Black men and women suffer disproportionately, likely due to inadequate prevention and mitigation of risk factors. So how can we disrupt this pattern? And I talk about this paper a lot, the barbershop trial, because it really is, in my view, a landmark paper and emphasizes and highlights the power that community can have in addressing disease. And this paper was published in New England Journal in 2018. And essentially what they did was they identified about 50 barbershops in the LA area. And all of the groups, the leadership in the barbershops were trained in identifying hypertension, in talking about lifestyle changes that could be made to improve blood pressure, connected patrons to primary providers. But half of the barbershops also had a Black pharmacist come and treat the hypertension in the clinic, in community. And this is what they found. So 52 shops were included. This included 320 participants. One point I want to make is that, and this makes perfect sense when you think about it, the rate of retention in this study was incredible. It was 95% in each arm. That is outstanding for any study. And the reason why is because you're taking care of the people in community. They don't have to go out of their way to get addressed, to get their hypertension addressed or to get attention. They don't have to stop their work and leave and go to some other place. They're addressing their health right where they live. So the fact that they had excellent retention makes perfect sense. And so the hypothesis is that the reduction in systolic blood pressure, that's the top number, after 6 months would be greater among participants at barbershops with the pharmacist-led intervention. And that's exactly what they found. And you can see that in this chart. So in the intervention group, there were 132 people and there were 171 in the control group. And the systolic blood pressure at baseline was about the same, about 153 in the intervention group, 154 in the control group. And at 6 months, they brought the blood pressure down in the intervention group to 125 millimeters of mercury, which is incredible. So that's essentially normal. They brought the blood pressure under control, and that is a negative change of 27 millimeters of mercury. In the control group, they still saw some improvement. Their blood pressure was 145 millimeters of mercury, and not to disparage that, that's actually also excellent, and we'll see benefits at that level. But we also know that the amount of stroke, heart attack, and heart failure that we would see is going to be much, much less in the group, in the intervention group with a blood pressure of 125. So they saw a net intervention effect of almost 22 millimeters of mercury, which is very significantly, statistically significant. And here's where this is the part of the data that really blows my socks off, if you will. This study was done 6 months after the barbershop trial ended. So the barbershop trial was 6 months, and you can see that there was a very dramatic decline in the first 3 months of the study in terms of the blood pressure. They started out at 155, and it came down very quickly. So by the end of 6 months, blood pressure was under control. But then when you look 6 months later at 12 months, you see that the blood pressure was still well controlled. And this is after all of the study investigators went home. This is no one's looking anymore, but blood pressure was still well controlled. And to me, this is the power of community, that people who care about you, who you trust, when you're surrounded by that, you're going to take better care of yourself. So how do we address this in Cincinnati? And that's when I saw this result, I was just blown away. And I'm like, how do we do this here at home? And it turns out that food is a real problem in the city. I have been touring the city to look for places where I can begin my work. And food deserts are 100% a reality for people on the ground. But what I've also learned is that food swamps, and you may not be familiar with that term, but food swamps are neighborhoods in which there's an enrichment of nutritionally poor, high-calorie foods. And food swamps may be even more detrimental. And ultra-processed food, and I can give you a really toe-curling talk about ultra-processed food. But the reason why we make them is because they're shelf-stable and they're cheaper. So while they are cheaper to produce, the negative impacts on our health are great. One answer to this is urban farming, and there's a lot of initiatives popping up about that. The problem with urban farming in cities is that we have limited land that we can use. It's expensive land. We need specialized skills and equipment. And in addition, there's the additional problem that a lot of the soil is contaminated by pollutants from cars, from people, from animals, that kind of thing. And so rooftop farming is potentially an additional tool. And I was made aware of a group in New York called Brooklyn Grange in about 2015 or so. They wrote a book called Farm on a Roof about their initiatives in creating literally a rooftop farm in New York City. And I got to see it in 2019. I went with my sons, and you can see this roof is about 2/3 the size of a football field. It is huge, and they're renting it. It's on top of an industrial building that's about 4 or 5 stories high, and it's literally dirt on the ground, rows of produce, farmers farming. You can see the beautiful New York skyline in the background. It's really incredible. There's chicken coops and beehives and kiosks where they sell food. Here's some more of the produce. And then there's these gorgeous bees. This was a beautiful September day. So I was inspired by this work. In their book, Farm on a Roof, they really want people to do what they're doing. So it's essentially a roadmap to how they created this rooftop farm. I should also say that their endeavor was so successful that they now have 2 more rooftop farms, 2 in Brooklyn and 1 in Queens. And they are responsible for changing legislation in the 5 boroughs. They now, any new building is required to have a rooftop, a green roof on it. So from 2016 to 2020, I started trying to find a location. So I did a lot of touring of different neighborhoods across Cincinnati. And then 2020, when COVID hit, I went part-time clinically to devote more time to this project. And so I was looking for a neighborhood that was a food desert, that had a cohesive community and was diverse racially and socioeconomically. And I found that in Northside. In 2021, this beautiful church, which was an old North Presbyterian church, went up for sale. And you'll notice on the left-hand side, this flat building they call the Education Building, which is now what I'm calling the Community Health Center, has this 4,000 square foot flat roof on it. I had engineers come take a look at it. And it turns out that it would be a reasonable site for a rooftop farm. So I bought this structure. And a little bit about Northside. Northside is this gorgeous flame-shaped little neighborhood. As you can see, this star along 75 here near West Mitchell, that's the nearest Kroger, the nearest large grocery store that is available to Northsiders. And the arrows show that there are grocery stores outside the frame of this map. But the closest one is about 1.8 miles from the center of the neighborhood. The north side is technically not considered a food desert, but I'll show you why. It's because the areas that encompass the definition of a food desert is that they have low income and low vehicle access combined. But this neighborhood has low income, mostly on the western third, really. When you look at the most recent census data, it's really the western third is considered low income. And low vehicle access is about half of the neighborhood, but those two neighborhoods don't really intersect. So it's technically not a food desert. But living here, and I've lived here now since 2022, I will tell you that it is operationally a food desert for many, many reasons. And I think one of the things we need to rethink is our definition of food desert. I think it's much more complex than low income and low access, much more complex. And I'll talk about that later. So the challenge to us is to create a new model to feed our people that emphasizes the foundational role of communities, in my view. So that star is the location of what I now call the heart of Northside. I bought the church in 2022. It's not a church any longer. I now call it basically a sanctuary, really, and a community health center. And I've named it the heart of Northside. And this is the beautiful roof. So I've in that time, in the last 2 years, I've had engineers and architects create a design, and it would cost $2 million to build this roof. And that's mainly because I would need an elevator, which is very expensive, and also to somewhat reinforce the roof because it would have to hold 100 pounds per square foot to hold a rooftop farm. There is a beautiful indoor space as well that I currently am working with a group, a 4-H group, to help develop indoor growing so that I can grow food here year round using these beautiful food towers, garden towers. There's also a kitchen, a commercial kitchen that I need to bring up to code. That's an additional $400,000, but I'm working on raising funds there as well. But the goal for the indoor kitchen or the commercial kitchen is to turn it into an upcycling center and also a place for teaching. My goal there is to have a teaching station with a video camera so that it would address the problem that people have of getting into the site to learn how to make healthy meals. I have several ongoing projects that I'm doing now, all addressing needs of the community. I'm working on blood pressure awareness. So this past summer, I was blessed with getting a student from the Urban Health Project, which is a nonprofit group of medical students, really, at UC, who are dedicated to community work. And so Caitlin Funk, who's now going into her third year, helped me create a farmers market blood pressure station, which we're working now on publishing the data. That work was done in conjunction with the Department of Health and the Urban Health Project. And I'll show you a little bit more about that in a moment. I'm also working on healthy food access. I'm doing an ongoing survey of people in the neighborhood on obstacles to healthy eating. And one of the first responses to that is a recipe book that we hope to publish online, at least in a few weeks. Creating healthy recipes that people can make from food they can buy in our neighborhood. And that work is being done in conjunction with our local grocery stores. And I started just this past Saturday, we had our first health fair. I'm doing a series of health fairs, and I'm doing those in conjunction with the Cancer Justice Network, Steve Sunderberg, who's just been an outstanding colleague and neighbor in creating health fairs to improve awareness and access to basic health questions. So this is a slide. I've actually had the news out here now a couple times. I feel so grateful. But they did a piece on the news when we opened up our blood pressure station in the farmers market, and that was really popular. So we had over almost 200 blood pressure tests in that summer period, a 3-month period of time. And this is important. So one of the things that I was hoping to identify in doing this work was people who didn't know they had hypertension that we could then connect to a provider. What I found though, and this kind of makes sense when you think about it, at the farmer's market, most of the people that attended were people that already knew that they had hypertension. But what you see from this graph, and this graphs all of the initial blood pressures of every person that we checked in the blood pressure station. So you see that it's a bell-shaped curve, which makes sense. But about 38% of the people had blood pressure over 130, which is not well controlled. And so 38% of all the people who came to us who knew they had hypertension and were either being treated for it or were told that they needed treatment but didn't want to accept treatment. That's another problem, is compliance. We had 38% of people who are not well controlled. But what we found is that over the 6 weeks we were following people and giving them information on the medications they were taking, answering their questions, giving them information on how food can improve their blood pressure, we found a reduction of their systolic and diastolic blood pressure of 4 and 5 millimeters of mercury. And that doesn't sound like a lot, but that actually brought everyone under control in that group that we were following. So this is it's scary that so many people in our community had blood pressures that were not well controlled, but it's still embarrassingly better than our national numbers, where only 25% were under control. So what will we see if we bring our blood pressure stations into more economically depressed settings? And that's something that I'm working on now. I'm trying to create a volunteer program of health professionals who look like the neighborhood. So I want people to trust the people that they're getting their medical information from. I want them to feel like they can empathize with people in their community. So I'm trying to create a volunteer program of people who will check blood pressures in the rec centers. There's a rec center in South Cumminsville, and then there's a rec center here in Northside that I'm hoping to open up blood pressure stations there. So this chart here, and I'm getting a little bit ahead of myself, but not really. And this chart shows the main diet that I share with everyone. And I'll tell you why. The DASH diet you've heard about, and the DASH diet is the diet I spoke about earlier, which is essentially more fruits and vegetables and low-fat dairy. And that diet has been shown to dramatically bring down blood pressure. The problem with the DASH diet is there are no randomized controlled studies showing impact on cardiovascular outcomes or mortality. If you want to look at hard outcomes like strokes, heart attacks, and cardiovascular death, we have to look at the Mediterranean diet. That's the only diet for which we have such data. And that's largely from the Predimed diet and the Cardioprev diet. And I'm going to show you those briefly. But this slide focuses on what is the Mediterranean diet. And of course, the bottom, what everyone forgets about the Mediterranean diet is that it sits on a foundation of community. And you can see that on this diagram. And that's why I love this diagram. Being together in family and community with friends and being active is an essential component to the Mediterranean diet. When you start looking at the food component to this lifestyle, really, it's fruits and vegetables is the largest bulk, also whole grains, fats largely from nuts, olive oil, and also beans as a source of protein and fiber. If you are going to eat meat, which is acceptable in the Mediterranean diet, they suggest you largely get your meat from fish and seafood. Poultry, cheese, and eggs and yogurt are also are the next step up. And you can still eat red meat and sweets, just less of them. And that's one of the things I love about it. It's an easy diet to explain, and it's easy to adopt. There's literally no calorie counting. So the results of the Predimed study, this was published in 2014 in the New England Journal. There were some problems with it. I actually give a deep dive talk on the statistics of the Predimed study and the problems and how they overcame those problems to the cardiology fellows. And I'm happy to come back and give that talk again because it's important. But essentially, the problems that they had with the Predimed study did not change the outcome. And the outcome is as follows. In people who were on a control diet, and the control diet was essentially an American Heart Association low-fat diet, as compared to a Mediterranean diet. And the Mediterranean diet was a diet that was supplemented by either nuts, and the nuts included walnuts, hazelnuts, and almonds. Or the Mediterranean diet was supplemented by free extra virgin olive oil. So basically, they just gave these people free nuts and or free olive oil. And they found in the two groups that were given free nuts and olive oil and told to be on the Mediterranean diet, they saw a significant reduction in cardiovascular events, largely driven by reduced strokes. So in 5 years, and you can see the other thing that's very important about this graph is if you look at a year, there was already a spread very early on in outcomes, very early on with this diet. And to me, that is very dramatic and important. And so you can see that there's reduced stroke and primary prevention of cardiovascular outcomes with the Predimed diet. And then they also looked at secondary prevention. So if you have had a stroke or if you have had a heart attack, heart failure, or vascular disease, they put those people on a Mediterranean diet, and they saw again at 7 years, the Mediterranean diet is the red line. They saw a reduction in all causes. So they saw a reduction in heart attacks, a reduction in stroke, a reduction in vascular disease in all groups at the end of 7 years. So you can see that this spread started taking place at around 3 years. So how am I overcoming obstacles to healthy eating in this neighborhood? I told you earlier, I'm doing a survey, an ongoing survey to people's obstacles to healthy eating, and I'm getting a lot of really great information. And the top 3 items are essentially cost, access, and not knowing what to do with the food. So these are the main difficulty in eating a healthier diet is that the store is too far away, or I don't have time to prepare a healthy meal, or I can't afford healthier food. Those were the top 3. Also, I'm too busy. I don't know how to cook food that tastes good. And no one encourages me to eat healthfully. So those are the main obstacles. And when you look at the food cloud, it really gets at the components that make community affordable, healthy, farmers markets, access, those kinds of things. So my response to that was I was able to recruit 3 wonderful students from Xavier University occupational therapy program. And they came and toured the local grocery stores. There's 3 grocery stores that are along Hamilton in the business district here in Northside. And they identified all the healthy foods that they sell. And they created this beautiful recipe book, Cooking from the Heart of Northside. And Jerusalem is one of the stores, Lyra's Market, and Morsel and Nosh, and Northside Express. My son is a chef, and he came, and the challenge to him, we wanted to take photographs of the food that was prepared. And my challenge to him was you can only make this food with a burner, an air fryer, and a knife, and that's it. And so he actually created these beautiful meals. And hopefully we're hoping that we'll get the online PDF version of the recipe book published next month. But we'll also be selling hard copies in the local stores. And I'm hoping to make a tabletop version that emphasizes community in Northside and the food that we have and that we grow here right in our own town. And so community can be a valuable tool to promote cardiovascular health. My goal is to bring health intervention into daily life. And in the study I showed you, it's the barbershops, but I want to improve healthy food supply and access across the neighborhood. There's considerable data that shows both improved food access and health literacy promotion in community can dramatically reduce risk factors of cardiovascular disease and cardiovascular events. So that is my goal here, is to address that. You saw this chart earlier. My response to that is the right side of this panel. I'm hoping to bring down cardiovascular mortality across all socioeconomic and racial and ethnic groups. Through community at the heart of Northside. We have the food, the farmer's market. This is it indoors, this is outdoors. And you might recognize that tall gentleman there. And the mayor has now been here twice. He came to our health fair this weekend. We have record fairs, we have weddings, we have choral events and art shows and parties. We're doing health literacy outreach through the blood pressure station. We have seminars here. This is one that was done in conjunction with Christ Hospital and Pfizer on heart failure we had in our community. And this is a cancer risk awareness health fair that we had. We had our health fair this past weekend, which was very well attended. We had a lot of really great vendors who gave out a lot of terrific information to the community. We hope to address health through food production on the roof and indoors, through the teaching kitchen, and through exercise and fitness. We have some spaces within the heart of Northside that I hope to turn into cardiovascular rehab programs so that we can address getting people healthy through exercise and community. So my ultimate goal is to show a reduction in heart attacks and strokes in this zip code over 5 years in response to the programs that we institute here. And if you have any questions or want to connect with me through my website, that's heartofnorthside.org. And I am ready for questions. Did I get everything said in enough time?
Oh my Oh my goodness. Thank you. Thank you. Can everyone tell why I said I was so inspired by her?
Thank
Dr.
you.
Rothenberg, you're doing incredible work. I'm going to open it up to Q&A. So far, I see a couple. I'm going to go to the Q&A. One says you said the nearest grocery store is 1.8 miles away, but you also said there are 4 groceries on Hamilton and Northside.
Yeah, when I say grocery store, I mean like a retail store, like a Kroger, where you can get everything. The small grocery stores that I'm referring to, like Morsel and Nosh, for example, they're really a deli, and they have a very tiny um, shelf area for other items. So when I say grocery store, I mean a mom and pop shop, really. Darussalam is it reminds me of like Cam, but it's the Chinese American market. And it has mainly foods that you would want if you're making like it's an African store, a North African recipes and that sort of thing. So they have a small selection of a lot of different things that you can get. So it's basically a small mom and pop shop. So you can't really go to these stores and get everything that you need. So what we did was we identified the things that each of those stores had and created this recipe book from the items that you could get in these small stores. So did that answer the question?
Yeah, I think so. Now they're coming fast and furious. So I'm going to try
Awesome.
and get us through them. Tom asked, do you believe seed oils are not good for you? Butter, question mark.
I am very evidence-based. I don't think that we have sufficient evidence just in seed oils. And I'll back up by saying that diet studies are extremely challenging to do. I have a hard time believing a lot of the reports out there in the news until I see that there's been a randomized controlled study and blinded if possible. And that's the trick in diet studies, is that you can't blind these studies. I want to see as many controls as possible in these diet studies before I believe the data. So I don't think there's enough data to support it. Do I avoid seed oils? No. Do I bulk up on them? No. I pretty much eat a Mediterranean diet and focus on olive oils if I'm going to use fat in my diet.
So that follows, Martha says, been told by a doctor to avoid dairy, needed calcium for osteoporosis, switch to almond milk with a lot of calcium. Is this good? And then also wondering about olive oil. I use it daily. I use it to make veggie stir fries. Could I be overdoing it?
So I'll back up by saying that individually, we all have our foods that we respond better to and less well to. When I have people telling me they feel like a guinea pig, I'm not surprised, because even in very well done studies, it's honestly statistics. We are looking at the greatest impact of a medication on the greatest number of people that have enrolled in this study, people who are going to be responders to this medication or intervention. In practice, there's a bell-shaped curve, and then there's the people on either end that may respond better or worse to this intervention, or may not respond at all, or may end up having more negative impacts to an intervention than positive outcomes. So everyone's different. I would I would see a dietitian for sure. Dietitians are highly trained. Um, they are certified in what they do, not and I don't mean to disparage nutritionists, but dietitians are certified in nutritional medicine. I would make sure that what you are eating is best for your health and the medications you're taking, because foods will interact with medications and other things in your diet. Um, Everyone's going to be different. As far as olive oil goes, if I recall correctly, in the Mediterranean diet in the Predimed study, there were 4 tablespoons of olive oil a day. This study was done in Spain, and they eat a really large quantity of olive oil in their diet. And so, can you overdo it? Absolutely. You can overdo water. You can overdo anything. But I would go back to the Predimed study and refer to that. And I'm pretty sure they had about 4 tablespoons of olive oil a day in their diets. And that's what they gave for free. Whether or not they ate 4 tablespoons a day is not clear to me. But they eat a lot of olive oil in their diets there. But definitely you can overdo anything. So do be cautious.
So Marlene says she's a retired nurse, also with hypertension, and was one of the folks on this ALAT hypertensive trial. Brianna's asking about PDF or PowerPoint being sent, and I think Emily Fleming posts all of our talks on our website, recordings of it with our speaker's permission. So you should be able to go back to Emily. Feel free to correct me if I'm wrong on that. Dr. Shaughnessy says she loves Northside Farmers Market. And her question is, has anyone thought to pair a mentor with a mentee with regard to learning food prep? I don't know if I understand that question.
Yeah, I'm not sure I understand that either. Do you want to
I
clarify?
don't know how to unmute her. Yeah, Dr. Shaughnessy, if you can let us know, pairing a mentor with a mentee, does that mean in the community? Let's see, I'm sure she'll weigh back in with us.
One of the challenges that I have found is Northside has about a third of the neighbors are African American. There is a lot of well-earned mistrust of the medical community that we have absolutely got a responsibility to try to overcome. And that's something that we don't really account for in a lot of the studies that we do, but we have to. And we have to address this intentionally and with an open heart.
This is Beth.
Oh, hey, Beth, go ahead. And then I'm going to finish off with Tom's question. Go ahead, Beth.
Well, I was just wondering, yes, it is within the community necessarily pairing somebody who already cooks in that way to somebody who doesn't cook in that way. One of the things I'm a physician as well. And one of the things I learned from my patients is a number of them, especially in the African American community, simply don't know how to cook or
Yes.
don't know how to cook well. And I had a patient who didn't even have any dishes or pots and pans. Um, so trying to pair them with somebody who already knows how to do it, they can perhaps have a little bit more one-on-one.
That's actually, as I was kind of getting at that challenge, um, one of the things that I'm trying to do is identify recipes. So in this recipe book, I'm bringing out or I'm encouraging dialogue, and I want to encourage people to send me recipes of things that are meaningful for them that either are already healthy or that we can modify to make healthier. If it's a recipe that has an emotional connection to them that we can make healthier, then they will eat it. And that's the main thing. They have to want to eat this food. It has to have some emotional connection for them. And so I'm working to try to create a series of recipes that will be easy to make. And so the challenge, as I was telling you earlier, for these recipes is I told the young women that it had to be something you could make with just a knife, a burner, and an air fryer. And that's it. Because I wanted anybody to be able to make these foods. The other thing is I'm working with a group that wants to grow food here in my site. And they asked me what I wanted them to grow. And I said, no, it doesn't matter what I want. What matters is what the neighborhood wants. It's not about me. If they're not going to eat the things that I like, then what's the point in me making these recipes? So and they told me, oh, I can tell you right now, they're going to want collard greens and they're going to want kale and they're going to want sweet potatoes. And so they're going to make the things that the community wants to eat. And I think that's also essential, is listening and responding to their needs.
So we have to wrap up, but I want to address Tom's question. I just can't. Tom, I don't know if you work at UC, but your question is, what grade would you give UC on the food it serves in the hospital? And I would say that most hospitals, including UC's, have a long way to go. The great news is our new-ish CEO, he's not new anymore, but Corey Shaw is on board with this. We actually just emailed about food in our UC hospitals about a month ago. So stay tuned. And if you want to help Tom with these initiatives, please reach out to me. Now all of these fabulous questions are coming in, but to be mindful of people's time, I have to wrap this up and say that yes, the PowerPoints will be sent. You'll get a follow-up from Emily. Thank you for joining us, particularly during the day. Thank you to Amy. Thank you, Dr. Rothenberg, for this incredible work. I am sure she would love for you all to stay in touch and help her with her many, many efforts. We hope you'll continue to join us, sign up for our Osher Center e-newsletter, join us. Our next event, this type of one, is in September. Please reach out with any ideas. And again, a happy and most importantly, a healthy day and a week and a new year to you all. And thank you, Dr. Rothenberg, for your leadership in this space. It's so critically important. So
Thank you.
good. Thanks all for joining us today.